Are we live?
We are.
Are we live? I was telling Colton, I said, good morning, Vietnam. I should say good morning, Saskatoon, Saskatchewan. And of course, my brain's so full, I can't even think of who actually was the big actor in that movie. So if you guys know, you just send me a quick tip. And I will think about it halfway through this presentation, I'm sure. So I think we're just getting organized.
Yep.
A little bit. So get your cup of coffee.
This is Colton here.
Colton's over here.
We're going to give a few minutes for everyone to get settled in and ready to roll here, since we know a lot of people are just going to be opening up their emails and trying to find out where exactly we're live. We want to make sure everything's working okay. Actually, I'll slide over too. And we just want to give...
Oh, here. I'll slide over.
Yeah.
Physical distancing here.
So we're going to give a little bit of time to get started here. For anyone who's tuned in now, we have some instructions in the comment or the description of the video. If you have questions throughout, just comment them on the video. Feel free to send us the questions directly if you want them to be more anonymous, and we'll answer them as well. One thing to be aware of is that there is a bit of a delay. We'll see your comments immediately, but I believe that you will see us about 20 or 30 seconds later. So if you ask a question and we seem like we're moving on, we probably have answered it, but it's still coming up. So keep in mind for that. We're going to do our best to get to all the questions. And again, we'll just give a few more minutes to get going. So I'll give you the center stage back here.
Good. All right. Sorry. I can't touch the ground, so I just got to jump under my chair. So yes, that delay is important. We haven't missed it. Maybe it's kind of like after a couple glasses of wine. It might take a while for it to register on the technology. So I'm going to go through a lot of stuff. I'm going to be doing a bit of an overview of last week's, if anybody joined in on the webinar. And there's going to be some critical updates to those. So don't think when I've answered a question that you went, oh my gosh, I've seen all this before, because in amongst the whole presentation, we're going to feed you some of the critical updates that have happened as relative to those areas that we're going to address. So I just want to, I guess if anything, have some patience. We might get to a point where you go, holy crap, I didn't know that one. So as Colton mentioned, we're certainly going to field some questions. There were some questions that came yesterday that were emailed to us. So thank you very much. They will be addressed. It was a couple. I know, Karen, I've got yours. So as we get to that section, when we're talking about the disability and the layoff, I'll let you know what would happen in respect to the question that you asked. I think that's it. Are we good? Do you let me know when to go, Colton?
We can get rolling. I guess it's just a matter of, I know some people start to trickle in as we get going because they're just opening their email or just seeing that, it's 11 o'clock and finding out where to go. Matthew Murray, thank you for the comments. The broadcast looks good. We changed it up a bit from last time. We got a whole setup here. We're going to share a photo of that. So again, as a reminder for anyone who just tuned in now, that if you do have questions, and we'll try and repeat some of these things throughout because I know that people kind of go in and out of the video, so I don't want anyone to miss it. If you have questions, please comment them or send us a message directly. That way, if you have anything kind of more private, we can share it and we won't mention who we've received it from too. Also, something to note, you'll see in the description, we have set up a link for a group that we've got going. We'll talk about this more later on, but it's a private group called Group Benefits, Frequently Asked Questions, and we're just kicking that off in light of all of the crazy changes. Let's just slide over. Sorry. Everyone's wondering who's talking here, the guy behind the scenes.
This is COVID issues.
Yeah. So in light of all the just insane amount of updates and changes that have been going on, we recognize the need to do updates a bit more frequent, but not just do updates more frequently, but create a forum that people could ask those, not just on a weekly basis, but maybe daily, and to share ideas and have business owners and managers connect. So you'll see a link in the description of this video, which is if you click it, you can request to join this private group that we're setting up where we'll answer questions that maybe we didn't get to today, and we'll continue conversations. And again, business owners and managers can collaborate on ways that they're navigating these COVID waters. So we'll keep mentioning those things later on because I know people will be joining as we get going here. But without further ado, we'll get the program started since I think we have a lot of people tuned in now. I'll leave it to Deb.
Awesome. Thanks, Colton. We've got a few of my team in the audience. I know that they're watching in amongst all the busyness of benefit work that we're getting in the last few weeks. Certainly at our end, I feel like we've been a bit of a, my analogy is I think if you're standing in the tennis court and someone's throwing all the tennis balls at you, that's kind of how we're feeling right now. They're coming like left, right, and center up. And it's quite bizarre. We just got another update today. So my point in all of this conversation today is don't look at this as being the end of the answers. Some of them were hitting the end. Some we're still seeing some updates, and we'll go through that, and I'll address that specifically to those areas. So first, certainly, thank you. My name is Deb Wiegers, of course, with Wiegers Financial Benefits and Colton Wiegers. Matthew Hill is listening online. He's one of our other consultants, so there might be some questions that he might field for us if I've missed some things. We've got Renee in the house. She's upstairs, but if there was any benefit related questions as it relates to retirement planning programs, I'm not the expert, but we certainly can handle those questions for you. So if you wanted to send that on a message, that would be awesome. I'm going to talk about this whole process. Again, last week I said we're going to do it in waves. So we're going to look at doing 45 minutes, about 45, 50 minutes. I know that there's going to be, maybe some questions that might be at the end. So I have no problem going a little bit longer, but I want to make sure I hit the gist of the things that I want to address in that 45 minutes. So if you have those questions, you can feed them to us. If we don't get a chance to address them, we can do them after, or we can follow up in an email or a phone call to you as well. I'm going to go through this again in terms of waves, what we've seen at RN on the benefits side as this whole COVID-19 pandemic started to roll out. So obviously, very briefly, it all started about a conversation around the travel, and I said this last time. So that's done. Like anybody who's traveling now post March 13th, you know what? We should stick them in a room and bolt them up. But nonetheless, there's people that still need to know that they've got insurance coverage, and that would be your essential workers or truckers primarily. There is still coverage intact for you, so never to worry about that. So that was just the one thing I wanted to cover off on the travel.
We want to give a quick shout out. I see the comments aren't showing on my screen here, but I'm able to pull them up on my phone. Jennifer and Doria gave us a little wave, so thanks guys for tuning in. I think Jennifer was in the last webinar too.
Oh yes,
right?
Yeah, she was.
So thanks, glad to have you guys again. So again, we'll just I'll be interrupting Deb from behind the camera as I see some questions in case they aren't showing up on the screen here. We're just navigating these waters still. So thanks everyone for tuning in. I see Denise Selby has joined us now too. She was there last time too.
Good.
So we got some returns.
Hi Denise. Well, and you know what? The good news is it's we're family, so you know what? If we keep interrupting each other, it's okay. So, okay. So what we're going to do is we're going to talk first about just a reminder what's happening with someone who thinks they have a disability or an illness. So the 4 scenarios, I'm going to repeat this because we're getting kind of a lot of confusion on one of the areas in particular. So the easiest one is if you've been diagnosed with COVID and you are ill, yes, you will go to the short-term disability program or to the group benefit program to put your claim in to get assessed. You need to understand everything on the insurance side, the group benefit side, is going to be based on medical evidence. So if you've been diagnosed with the COVID, easy, you're on. If you've been told that you should stay home, you call 811, you've got symptoms, you can go to short-term disability, but I'm going to caution you because just because someone has got a cold or a cough or 811 said stay home or your employer said go home, that doesn't necessarily mean it's going to be a short-term disability claim. So to Karen's question, it still has to medically qualify on the short-term disability side. I would almost want to suggest, and that would just be me, I would say you're better to go first to EI and lay that out to the employee that you still have to be, your claim's only going to go through if you're medically ill based on a short-term disability definition. So if you put the paperwork in for EI, you can at least get the ball rolling. If it happens that there is an illness that comes as a result of that, yes, absolutely, the short-term disability plan will take over on that. There is people saying, well, what happens if I just don't want to go to work and self-isolate? We said, no, there is just no claim on that. That's by choice. That is maybe the employer said, I don't want you here, you go home. There's still no claim on short-term disability on that level. And then the new one that's popping up now is quarantine, because we've had a few clients now that have had someone in the organization that is COVID positive. So the public authorities shut them down. Everybody's in government quarantine. And to the ones who aren't ill, no, there's no benefits for you. There is one of our association programs that will take the claim if it's on a quarantine level. But only this association. Every other insurance company out there at this point is still saying the sick individual will get the claim. The other ones that sadly got caught in this will have to stay home, and there is no short-term disability claim. EI would be your route. There's a question?
I do have a question. It's not really relevant for anyone watching because you're, of course, here. But someone wanted to find out, so I'm going to tee this up. In the event page, we had a link to our Facebook page as the host, but some people weren't too sure, obviously, that we had gotten going. So I'm going to, Kathleen was the one who sent it. If you are here now, great. But if not, if anyone might be stuck there, I'm going to help them out right now. So Debbie, you won't see yourself on the screen. So
okay, no worries. No worries. Okay. So we've identified that, what and where when it's a potential claim. Is it EI? Is it short-term disability? And that is still obviously an ongoing call that we're getting in our office. Now let's move to the one that, unfortunately, at the stages we were in last week, we were having a lot of communication, a lot of conversation about what would I do? I'm kind of thinking about layoff. I'm not sure if I, need to, don't want to. And sadly, unfortunately, this week we're seeing a lot of that. So what to do on a temporary layoff? It's really important that you understand what your group contract says and is changing to say. So by that, I mean that the group contract has an opportunity that if you're laying off an employee, you can, as an employer, make a decision if you want to extend the benefits to your employees. And there's certain timelines that go along with that. So the quite regular ones we're seeing, the life and the health and the dental, would be 6 months up to a year. So that one's an easy one. Where we're talking, and everybody's worried about what's happening in the next 2 to 4 months. And that's the disability. So at this point, I'm happy to say that now all of our carriers that we work with are on board, and they're extending the opportunity to extend benefits for disability if you're extending the benefit program to your employees. The average that we're seeing is now 90 days. So if you lay off someone today, now you can tell them that we're extending benefits and I can keep you covered for disability for up to 90 days if something should happen. Now, the thing you want to think about, and there's 60 days, there's 90 days. I now have had one supplier that came in and they're now 120 days. So they're extending disability, short and long, if you have short-term disability, but up to 120. But the average is 90 days. And you need to understand the importance of how that aligns with what you might be thinking about on your ROE, your return to work date. Because if you are wanting to make sure that these employees don't fall through the cracks if there was a disability, you want to think about aligning your return to work date exactly the same as the extension of disability date. So April 1, you do a layoff. You count on the calendar 90 days forward. And on the ROE, you'd want to put, I believe the date on 90 days forward would be June 29th. You want to have that as your return to work date because this is a temporary layoff. None of us know really when we're going to all get back to our normal lives. And so if that return to date is not where it's going to be on that when that arrives, you would just lengthen it. But you need to understand the difference, the gap in between the 90 days and whatever that return to work date is where your employee does not have any insurance coverage for disability. So that, as long as you know that and you communicate it to your employees, but you need to be very clear on that. The first 90 days, if they should get ill or injured, they're going to be covered through the insurance company once they've hit that return to work date. That's when now it backtracks over to the group side. And now you put the claim in for the disability through your group plan. If you've got no short-term disability, you're probably going to have to, or the employee's going to have to continue on unemployment until they're eligible for long-term disability. Most long-term disability programs have a 119-day waiting period. So 90 days and 119 days. You got to make sure that if there is a gap in there, you're going to just tell the employee they're going to have to continue on with their EI And then when they're eligible for long-term disability, they can now go onto the group plan. So start the paperwork, make sure that the wheels are rolling on that, because that might minimize some of the delays.
Just want to chime in. I see there's some comments from Jennifer and want to make sure no one else is having this problem. That it sounded like it was lagging a little bit. So might be a couple people that were running through that. So we'll do our best to slow things down a little bit. When we were testing this earlier, we had no issues. It was going all through. But just in case we have a lot of people viewing and we're running into some issues there, then we'll try and slow down. So she said, can you repeat that, Deb? But that might be from a couple minutes ago. So maybe backtrack on the point you were just making. And please do let us know if there's any lags or issues and if we want to go over anything else.
Okay. So I'm going to, and I'll watch Jennifer to see if you answer back. So I'm thinking you're asking about maybe the return to work date and how it aligns with your extension of disability benefits now that the insurance companies are offering. So the insurance companies are offering that when you extend benefits to your employees, if you as an employer you are now able to extend the disability side, because that was the one thing that a lot of insurance companies weren't providing a very long or if at all extended option, was the disability. Now, most of them are going to 90 days extension. And then what I'm trying to encourage my clients is to look at your return to date and align it with your 90 days extension, so there's no gap to the employee should something happen. If he has an illness or injury post those 90 days and your return to work date is over here, he now has no coverage. So you want to align them so that they're saying the same thing. Now, if you're doing an extension of any benefits, obviously you have a decision to make. So you have to look at premiums. What are you going to do? So that's where we go to our layoff toolkit. And what we do is we will suggest the steps that you need to go through. And one of those important steps is you need to decide, if I'm extending benefits, then how am I going to arrange our payment of those benefits? And most of my clients are saying that they're going to just assume the same cost share arrangement that they had going into this. And you'll have to make a decision. Are you going to take a few months of premium off their last paycheck? You've got to be cautious with that. You can't take too much. Do I do post-dated checks if anybody does that? Do I do e-transfers? That's probably the one that's going to be most common, I think, in today's world. And you need to define the what if. What if I don't get my payment in 7 days? What is my position as an employer? You have to be very clear on that, because you don't want to be their banker. You need to determine that what's reasonable. If they don't pay by a certain date, what's your position? Are you going to have to make a stand and say, if I don't get my payment in 7 days, we have to terminate benefits? Because you don't want to be that person that's having to call and collect checks or payment from that. I do have, and it's a very gray area, and we have a couple that of our tax advisors are looking into this. And I know that in the big conversation of benefits on the global side, is some employers would just pay the whole premium and worry about what to do with this later, and maybe at least make an agreement that you're going to get the premium back when all things settle and your employee's back to work. But obviously we know what happens if he doesn't return to work. How are you going to collect premiums? So there's a question. Oh, okay. I'm just reading as we look.
Just a comment from Matt, part of our benefits team.
Okay.
He just wanted me to add in. I don't know if it would fit into what you're saying now. He
Late employees on the lay them off on the benefits. So in other words, yes, good point, Matt, because only one insurance company has suggested this, and I don't even think it makes sense, to be honest. If you're doing a layoff, you need to contact your insurance provider. And if you're not sure of the process, you need to call us, because I'm very keen on documenting, communicating, because you need to understand this isn't one-offs that we're dealing with anymore here. We're dealing with hundreds at our end. And for us, it's very important that we communicate that the employer has to do a consistent process. They need to document, they need to communicate, you need to put it in writing, because somewhere down the road, you know, the old adage is not if, it's when. If it's when they didn't understand what you told them, if it was, you can't find this in the communications. So that's why I've come up with our toolkit that is a checklist of decisions that need to be made, a communication that needs to be made with the employee, and then the letters that need to be signed. If that employee says, I don't want the benefits, that's his choice. You need to get a sign off, and you need to put that in your file, because later on, if something should happen to him, there's no fallback to the benefit plan. So that's really, really important. People have asked the question too, if we have gotten through the layoff period and this person does get disabled and we do determine they can have recourse through the group plan, what's the benefit amount going to be based on? So that was an important question last week, I think, from Denise. What's it going to be based on? So it's going to be based on what you had indicated in your ROE. What was the salary indicated in the ROE? But you need to make sure that that amount aligns with what you're billing them on. Those two need to look the same. So it's whatever what they were earning on their last day worked. That's what the disability benefit will be based on. I think we've covered off the layoff. If there's other questions, it's complicated. There's lots of moving parts. And if you didn't get it right now, I totally understand. That's why, by all means, give us a call and we can walk through that with you. So it definitely, again, if you're calling the insurance company, we always tell our clients, call us. That's our job, is to help make sure that you've covered all those points and we've given you good guidance on that. So if you're reinstating, if you're doing a layoff, just know too, on a layoff, once you get past 6 months, which again, I hope we're not worrying about that, but once you get past 6 months, there's a good chance that there's not going to be any disability or benefits available unless you're now reinstating with evidence. When we talk about, let's just go to what's going to talk about different things that the insurance companies are doing. Let's back it up. Premium payment. I'm going to remind you again, insurance companies are on your side. 30 to 60 days, they're willing to defer the payment for premiums. If you don't have any idea what you're going to do and we're going beyond that, then you know what, pick up the phone, call the insurer, say, we have a problem. Our clients will tell them to call us, but call the insurance saying, I'm stuck. Can you work something out for me? They're willing to work with you. Renewals in the next few months. I'm seeing a lot of insurance companies that are saying if you have a May or June renewal, they're deferring it for 2 months. So if there's any increase, they're deferring the increase for a few months. Again, they're trying to make this easier for you. There is maybe some of you out there that have just moved to new carriers, to new insurance companies with your group plan, and there is a lot of that was going on. They were doing rate guarantees on the life and disability, rate guarantees on health and dental. It's all over the map. But don't be 100% that rate guarantee is going to hold. Some are saying that it's really on a case-by-case basis, because you need to understand the insurance company's perspective that if you've had to lay off 70% of your people and everything's changed on the demographics and the volumes of what they were initially guaranteeing on, it's not going to make good business sense for them either. So, but if there's a conversation, they're saying, look, honest, my promise is we're going to be back to 80% capacity. That's a plan. Then there's a good likelihood the insurance company is going to be on your side and honor that rate guarantee. And again, we're watching what we've done with our clients and had those conversations with the insurance companies to just know where that conversation might go as we get into the next few months of this. Access to services. We had a comment last week that people said, well, what's the point of keeping benefits? I can't get any insurance coverage anyway. A couple of thoughts, couple of things that we're seeing in direction, and it's moving a little bit more than it was last week. So the big one right now is dental. Unfortunately, there is no opportunity to go get dental work other than emergency dental. They're still open for business on an emergency level. So you as the employer can make a decision if you're going to just either terminate or suspend. And again, this is another new piece, because before we were just talking, you'd have to terminate. Now we're seeing some insurance companies are saying we'll suspend. So it just minimizes anything that has to be restarted at the end of this. If you're suspending, there is no benefits, right? If you're suspending a dental benefit, there is no benefits. But at least you're not getting into a situation where you might have anything that's pre-existing. Because when you terminate it, now there is what's called a pre-existing clause. And we can go through that a little bit more if you have questions on it. Jennifer's asking, do you recommend starting short-term disability to get the paperwork going? It doesn't hurt. I know some of my clients were all over the map because if they're doing a lot of layoffs, they got to decide the capacity they have. But yeah, so the sooner you can get it going. The one thing that you don't want to do, you don't want to promise the employee that that's a for certain. You have to really emphasize the fact that the short term on the group plan will only be in place if you're medically diagnosed. No different than the plan design today. It hasn't changed. You have to medically qualify. So staying home because you have a cough or you're got a fever, it's not going. It has to medically qualify. I can't stress it enough. I know I've said it lots. We're just getting those people that are coming back now going, oh my gosh, my employee was kind of relying on that. And now it's not happening, right? I know. I want the dental to come back. That's why we're saying suspend so that we can just keep it on a reserve basis. But here's my suggestion, and it's only a suggestion, is what we've implemented is that we've said, look, we don't want people to be out if something happens. If someone has an abscess tooth or issues with, a recent root canal that they got done, I want to make sure my employees are covered. So what I've done as an employer is I put a spending account in. So the provider I'm working with allows us to specifically design that to say for emergency dental services only. And as an employer, I choose the amount that I'm willing to provide. Because at the end of the day, we'll all hope that no employees have issues. And that's good. But at least peace of mind is in place that if something was to happen, they've got some coverage. You also know that if you allocate X dollars to all your employees, don't worry, they're not all going to spend it because not everybody's going to get emergency dental work done. So it looks like it might be a big budget line, but you have to look at law of averages. What's the average in your group that you'd expect might have an emergency claim? I don't know what that answer is either. 2, 4, but that's what we're doing. So again, I encourage you that if you have to think about budget lines, you need to drop the dental, suspend it better. Then you might want to look at maybe augmenting that with a spending account with a very specified purpose, emergency dental only. If I've got another spending account that's used for anything that's covered under CRA, but this is a separate piece for us. That makes sense, I hope. So the other thing that we're seeing is there's getting to be a better uptake and a fast tracking of paramedicals, practitioners. We talked about this last week. So that would be things like your physiotherapist, your psychologist, your dietitian, naturopath, those things. But again, everybody kind of thinks about, well, that's kind of one of the main things that people like in a group plan, which I understand it is. The only one that at this point has not been able to provide some element of virtual care is massage. I'm not sure what they're working on, if there's something that they can do, but they would certainly be included at a point when they can have something that's available to the end user. So virtual claims will be covered by insurance companies. Some are a little bit slower in terms of, rolling it out in terms of all the paramedicals that are out there. But I believe it's like a race. Once gets here, they come and meet you. Then they go there, then they meet. And this is exactly what we're seeing. It's just one person gets out the gate, they keep following through with that. So at this point, yes, virtual cares are on the uptake. And I think that's a great thing. There is certainly some services that are offered that are on the technology level, telemedicine. There is some clients of ours and you as employers, you might be familiar and have telemedicine. So that's important because now when people are in isolation and they aren't leaving their house, how do they get care from a doctor? So now this telemedicine piece is in place to help you get access to care. It helps you get access to get prescriptions. You're probably going to be looking at a lot of pharmacies doing deliveries. And I know there's some insurance companies that have already said, we're kind of offering that. on a global level, but I'd like to say let's stick to our community, the pharmacists in town. I'm sure that if someone needs to have, a prescription filled, I'm sure they'll work out a way to get it to you so that we can still keep within social distancing. It's 11:30. I've got 15 minutes to rule here. One thing that we're doing on the virtual telemedicine is that we've got that on our website. So it is a product that you can go online, and it's like a shopping cart. You can just buy and add it as a single and as a family member, and it's voluntary. So we really focused on voluntary benefits. As you're going through, sadly, people that have to terminate their group plan, you need to let your employees know there's some options out there. They can convert their health and dental if you're terminating the plan, and they need to do that in 60 days. We've accommodated to make it a bit easier for our clients. We've embedded that to our website. Blue Cross, and a shout out to Blue Cross, big, huge community supporter, and they certainly have one of the more robust health and dental programs on an individual level. So there's two ways in which you would go to our website. You would buy it either as a conversion, so there's no need to prove evidence of health. That's very important. That's why we have conversion available for our group plans. If someone loses coverage, they can get their health and dental on an individual level, and there is no medical evidence required. But for those who never had an option to convert, they never had benefits in the first place, of course, you can get health and dental on an individual level, but there will be some medical questions asked. So you'll see that when you go to our page. If there's any questions, again, we're more than happy to help you out with that. All right, we're moving along. We want to really stress the importance of anybody who has to make changes in the group plan. Really, I don't want you to drop your employee assistance program if you have one. That's a really, really important piece that your employees and their families need right now. What you need to do is help them understand that this is an important tool and resource for them. So keep reminding them that they can access the EAP. There's lots of different things going on out in the marketplace in general. And so when you see them, tap into them. I want to do a shout out to Bridges. They've got a couple things going. They do have a wellness app. It's called Avail, and it's there not just only on the EAP level, but it's really taking wellness and well-being to the next level. So that's something that they're offering to customers. And they do have a webinar on dealing through all the stressors that we're all dealing with, April 8th. So definitely, check in with Bridges. April 8th, they have a webinar. These are the kind of things that we're seeing from our community, our clients, and our preferred providers, like Bridges being one of them, and Blue Cross. So, shouts out to them for doing that for us. We're at 11:33. Okay, no questions. We're good so far. I'm doing lots of talking, but I'm very good at that.
I'll jump in quick.
Okay.
This is Colton from on the side of the camera here. Again, for anyone who joined, if you have any questions, please comment them below. I see Jennifer been commenting a few times here. She says, such an affordable program to keep with regards to the EAP. So by all means, let us know what things you want to learn more about, or if you have questions, if you just want to kind of make a comment to us. If you'd like as well, you can send us a message direct to our Wiegers Financial Benefits page if you'd like to ask anonymously, and we'll answer that question live as well. And then anything we aren't able to get to, if we get some questions that trickle in at the end or afterwards, we will be updating them in that Facebook group. So again, I mentioned this at the beginning, we have a private group set up. The link is in the description of this video. We'll post that again in the comments. If you click on that link, you'll request to join this group. The purpose of this group is to keep updates coming to you guys on a more frequent basis, to engage in some discussions with you guys on specific issues you're seeing, and have it be in a more private setting. So it allows you to discuss maybe with other managers and business owners on what they're doing to navigate some of these issues. So take a look at that. We'll mention that again one more time at the end, but as a little kind of midway break, just to give you guys the scoop on, again, what we're doing with this video and beyond that as well. So I'll hand it back to you, Deb.
Perfect. Okay, so I'm going to just kind of go through some miscellaneous things because we're getting lots of different kind of situations and surprises. And so what a better time to tell the audience of some things that you might not want to do, or you might want to maybe just remind. First case I've had, we had a situation who had COVID symptoms and was told to stay home. So of course, there's no work for this individual, so they were directed to EI to put a claim in. Unfortunately, this person could not get EI because they don't have a valid health card. So then the client asked if we could talk to the individual to say, what could we do on the group side? I can't help either. He's got no valid health card. You need to remind your people that they need to make sure that they have a valid health card. I know that's a very simple one, but this individual's response was, well, I got tired of renewing it because I was moving too many times. So just saying. Another thing that we've seen is when we get into some situations where there's an opportunity to opt out. So if we're dealing with, for example, leased operators, and some might not want to have the group coverage that's being extended to them through their benefit coverage. And now we've had them calling us, or the clients, the administrators calling us saying, can we get these people on the plan now, because they're truckers and they're traveling and there's a lot of risk that they're taking on right now. So now they want on the group plan. I can't promise you that we can get them on. If we can make a case for it, we can get them on what's called an open enrollment. So the insurance company's making a decision to allow us to, at that one moment, that everybody who's not on the plan gets one chance and one chance only. You get on the plan and you're going to be okay. You don't have to medically qualify. So that's just on an exception. The other way that you can do that is that you can put in for being covered, but you're going to be medically underwritten and you may not get the coverage, because kind of consider it like late applicant. You're not going to have the insurance coverage. So in the future, when you're having conversations with people that don't want to be on the group plan, this might be a good time to have a conversation about what happens if you don't, right? So we were happy. In this case, we had 2 of those come to us, and we were happy that we were able to negotiate to have an open enrollment and get those individuals on the plan for coverage. So it was a good ending on that. I don't think I have to say, but encourage everybody to utilize online. Don't use snail mail. If you want to move things quicker, you got to use online. And certainly if there's any problems or delays that you're seeing, you know what, it is to be expected. So you have to just caution your employees that things are just going to take a little longer in terms of reimbursement. Another one, I said this last week, because again, what's happening is a lot of knee jerk is going on right now. And a lot of people, I know my larger clients and a lot of my clients, we've coached them along the way, the importance of having policies and procedures, an administrative checklist, what you need to identify of those don't get caught with your pants down things. You need to have that documented and well communicated. And it's really important now to evaluate and review your policies and make changes. If you need to make changes, reach out to HR people. We've got a couple of preferred HR consultants, Gary Mearns, who spent many, many years at Federated Co-op and teaches at the university now. He's really been our good go-to, along with my office manager, Pat, who's very keen on this stuff, and Hanif from Express Employment. He certainly has a lot of great knowledge in terms of the HR and those types of things as well. So I can't stress enough that you really need to, now is the time to look at that stuff and make sure that you've got it in order. I think I'm kind of getting to the end of what I needed to do. I know that one of the comments were people that are in associations that aren't able to pay their association coverage, and whether or not that ties or links in with their ability to keep their benefit program, because sometimes it is. So I am hearing that they're laxing on the requirement to have a membership in order to keep benefits. So again, bring those questions to us and we'll see if we've got some answers or we can navigate that for you as well. So, wow, I think this went really quickly. There was another question that came up that came from Diane. If you're in the audience, Diane, you had asked about the Chambers of Commerce. We are one of the representatives to do the Chambers group plan. And I think this is important to probably do a shout out, because there's many, many clients that are under the Chamber Association plan, that they were at one time the only company that did not provide any ability to extend the disability benefits. They will allow you to extend your health and dental, based on those things that we talked about earlier in the webinar. And so now what they've just, like hot off the press this morning, they've said now they're opening the disability to a 60 days extension. So I was really excited to see that, because now we've got really everything from 60, 90 to 100 days on extension of disability. And again, if you're extending benefits, you need to be keeping in mind, and you need to communicate and have a game plan for how you're going to pay it, who's going to pay it. And you need to make sure that the employee understands their responsibility in that. If there's no premium paid, there is no extended benefits on that. Wow, I'm feeling pretty good. I think I am actually ahead of time, which normally that doesn't happen. So I don't see any questions coming in that I haven't addressed. No, I think got it, Colton.
Yeah.
Yeah. So how's everybody doing out there? Like, are we all like, I know this has been a stressful, trying times for all of us. I know for us, and I know many of you are working remote. It certainly is interesting, and it creates challenges. But I know as a group that we stay very well connected, and we really try to take the time to really share and allow ourselves to have those conversations beyond that business level, that it's more human. I encourage that because I think that's where we're finding is a lot of people feeling when they're at home. When we say they're feeling isolated, they're really like feeling isolated. If you can only imagine those people that are in their own apartment with nobody, not even a cat, that's got to be tough. So just as employers, at HR, I know you're really, really busy. You know, you're fighting, firing on all cylinders, just trying to keep the business going. But there's that element to human that you still want to, have when it comes to just reaching out to those employees. And, maybe that's where I know for us, we've gotten into a workplace chat that we share business, but we also have some fun with it. We might have a fun posting at the end of the day. And you know what, it's just like one of those, okay, this is good. We're all in this together. So I want to stress, we're all in this together, and we're going to get through this. And it's not going to be easy, but I'm an internal optimist. I believe we're going to get through this, and it's going to be a little bit of the survival of the fittest. And I think for a lot of clients of ours, we're learning to even just look at how we do business differently, how benefits is done differently. It's going to be just about doing things differently. And so it's that think out of the box that has to probably start to happen a bit more than we ever thought it would have to be. So, yes. And yes, to Angela, I mean, I know from our end, we've got hundreds and hundreds of groups that we take care of. And the hardest thing for my team is when we have to coach them for termination of benefits because they have to close down their business. And my heart goes out to them. And so for you employers that have been able to work out ways in which you can keep your people working remotely, hats off to you, because I know it's not easy. And I know that your employees are very, very thankful and appreciative that you've been able to do that. So even though sometimes they may not, I know from our team, every once in a while, we just have those conversations. It's really nice to be reminded that everybody on both sides of this, the employer and the employee, we have our challenges. Let's work together on this, right? So, yeah. And different and better. Yes, it is different. I don't think that's a bad thing. I think sometimes maybe we got too comfortable. Maybe now we have to start working out of the box. And maybe that ends up to be the better thing at the end of the day when all the dust settles. So, again, I think it's good.
Yeah.
So,
thanks as well, Kirsten. I see your comment there about shout out to Marissa for helping me with past week, and thanks to everyone at Wiegers Financial. We're doing what we can to help. So again, one last plug to, if you have questions, send us them direct. Comment them as well if you want us to get to something. And check that video description for the private group. I know some people have already, while we've been on this video, been requesting to join. We're going to continue to update things there. And Deb mentioned Workplace. And honestly, that has been a pretty big game changer for us as an internal communication tool. It's called Workplace by Facebook. It functions the exact same as Facebook. And it's really been very helpful for us to do calls, video calls, private messages to our team, individually to each other. It's been a great tool to keep people connected, even when we're not all coming into the same building every day. So if anyone's curious about that, we'll post other tools and information like that in the Benefits Frequently Asked Questions group. So join there if you want to see more updates and HR tools and other things, and we'll share about how we're working through this COVID situation.
Yeah, and I think we're going to be doing this, as Colton mentioned, regular. So our game plan is to be doing this next Thursday, rather, at the same time, 11 o'clock. If you have any questions that you want at this point in time, feed them to us. And in preparing for next Thursday, you might educate me on something I didn't even know. So I really, really appreciate that you can do that. I want to give a really huge shout out to my team, because this has been really tough for all of us. So sorry. We've been through a lot of tough times together, and we're learning a lot to do working together. So I understand, and we've got a really, really awesome team. And sometimes they want to put me in that closet and that big padlock that I said that company's going to make billions, because I'm probably sometimes just maybe not the best and easiest person to work with some days, but we've been working really, really well together. And the fact of the matter that we can all talk and share, that's really, really important. So HR, like Pat's been working like crazy to get us all together. Our management team, my benefits team, they've been awesome. And our financial planning team, we work very, very close together because we do the retirement and the personal planning side. So we're getting both kind of sets of that stuff going on right now. So I hear you, I feel you, I'm with you. So with that, have a wonderful day. Stay healthy, stay safe, and stay optimistic. Thank you for joining in.